Hello dear students. So today I'll be talking about defense mechanism of gingiva. What is defense? A number of mechanisms operate to protect the body from attack by foreign bodies and toxins, including infections by bacteria. So this is called as defense mechanism. Specifically in the oral defense shield, there are various components. It can be innate components and there are acquired components. In innate components, it includes anatomical factors, temperature, hydrogen ion concentration, oxygen tension, salivary factors, which includes various lysosomes, proteins, thiocyanates, lactoferrin components. In case of acquired component, includes humoral and cellular components. Basically, defense mechanism of gingiva is divided into two mechanisms. It can be non-specific mechanism or a specific mechanism. In non-specific mechanism, you have bacterial balance, surface integrity, surface fluid and enzymes, phagocytosis, inflammatory reactions. In specific mechanism, we include GCF, saliva, and leukocytes. Now, in this lecture, I'm going to give you brief details about your specific mechanism factors. Coming to the gingival clavicular fluid, the anatomy of a gingival crevice is the shallow crevice or a space around the teeth, which is bounded by the surface of tooth on one side and the epithelium lining the free margin of the gingiva on the other side. The three important types of epithelium found here is the oral epithelium, oral sulcular epithelium, and the junctional epithelium. As you see in this picture, there are three areas which is marked. Number one, which is in close approximation to your tooth surface, is your junctional epithelium. Number two is the sulcular epithelium. Number three is your oral epithelium. Gingival crevice fluid is a complex mixture of substance derived from serum, leukocytes, structural cells of pedontium, and the oral bacteria. Initially in 1959, they were thinking that GCF is a transudate, but later Loh et al. In 1965 demonstrated that GCF could be an exudate or inflammatory exudate. The composition of GCF includes cellular components including bacteria, desquamated epithelial cells, leukocytes, various electrolytes including potassium, sodium, and calcium, various organic components like carbohydrates, proteins, and lipids, metabolic and bacterial products, inflammatory mediators, host-derived enzymes, and their inhibitors, bone-specific proteins, and tissue breakdown products. It exerts its defense mechanism by various following steps. The first one is it cleanses the non-adherent bacteria and their toxic products and the metabolites from the sulcus. It contains plasma proteins that may improve the adhesion of the epithelium to the tooth. It possesses antimicrobial properties, exerts antibody activity to defend the gingiva, contains a wide array of biochemical factors offering potential use as a diagnostic or a prognostic biomarker of the biologic state of the pedontium in both health as well as disease condition. If the GCF fails in using its components of innate immunity to defend the pathogens, then they enter into the connective tissue and the following things happens. The alternate pathway of the complement system gets activated. The release of complement components such as C3A, C3B happens. Degranulation of the mast cells and release of vasoactive amines, triggering the inflammatory response. Neutrophils comes out of the connective tissue and the bacterial killing by the neutrophils happens. There are various methods of collecting this GCF, including absorbing filter paper strips, micropipettes, capillary tubing, three-way twisted threads, gingival washings, intraclavicular techniques, or extraclavicular technique. The first thing is the absorbing filter paper strips. As you see in these pictures, you have demarcation of white and orange color. It is always preferred to hold your strip at the orange colored area rather than the white area, which is usually inserted into your crevice to measure the amount of GCF. It's a diagrammatic representation of these steps included in absorbing filter paper strips. Now a short video about how to collect your GCF.
Forces in patients with controlled periodontal disease. To measure gingival clavicular fluid volume A specific method is used and will be demonstrated in this video. A machine called Periodon is used for measuring gingival clavicular fluid volume. First of all, it's necessary to clean the periodontal electrodes with a gauze moistened with 0.9% saline solution. The periodon is then calibrated before measuring the gingival clavicular fluid volume. With the patient already on the dental chair, the sites are isolated with cotton rolls and softly dried with air blasts. An absorbent paper strip is needed for gingival fluid collection. The absorbent paper strip must be held by the orange mark so that fluid collection is not jeopardized. It's inserted 1 millimeter in the gingival sulcus, being careful not to contact other tissues, and then left there for 30 seconds. After 30 seconds, with the electrodes previously cleaned, the paper strip is positioned between them and the gingival clavicular fluid volume is obtaining periodon units. After the fluid volume measurement, the paper strip is stored in an Eppendorf tube for further analysis in order studies.
So I hope now you came to know about how a paper strip is used to collect your GCF. The amount of GCF is measured using your periodon. But then if you have to analyze your biomarkers, you have to use certain chemical agents and place it into the endorphin tubes and further use it for your biomarker analysis. So now we are seeing about the absorbing paper tips. It is similar to your GP papers. And then comes your micropipettes or capillary tubing, which is used for collecting your GCF. Then you have 3-way twisted threads. It can be intraclavicular technique or extraclavicular technically used. Coming to the clinical significance of your GCF, it is an inflammatory exudate. It is increased by mastication of coarse food, toothbrushing, and while gingival massage, during your ovulation, hormonal contraceptive usage, smoking, or as in a circadian periodicity, or after periodontal therapy. The commonly seen drugs in your GCF are tetracycline, minocycline, erythromycin, clindamycin, and your metronidazole. Drugs in the GCF, it may be used advantageously in the periodontal therapy. Coming to the second component of your specific mechanism in defense of gingiva, it is the function of saliva. It includes various protection, buffering action, digestion, facilitation of taste, defensive against the microbes, ionic exchange between the tooth surface. The most important in our topic concern is the defense action against the microbes, which includes lysosome, lactoferrins, and IgA. These are the basic information about your whole saliva. The main component is 98% of water, 2% of inorganic and organic substances. The pH of your saliva is 6.5 to 7. It has multiple functions. It can be antibacterial defense, clearance, digestion, lubrication, mastication, rinsing, solubilization, swallowing. It has production of 0.5 to 1.5 liters per day. Salivary biomarker usage is there in your oral disease-related, systemic disease, inflammatory biomarkers, periodontal pathogens, as well as keriogenic microorganisms. Other properties of your saliva usage is screening, diagnostic, prognosis, and treatment evaluation. In this way, saliva plays an important role as a defense mechanism of gingiva. Kindling your basics, the source of saliva includes 3 main salivary glands, which are parotid gland, submandibular gland, and the sublingual gland. Coming to the third important component of your defense mechanism of gingiva is the leukocytes, which is found in clinically healthy gingival sulcus, predominantly PMNS. A living PMNS in your saliva is called as orogranulocytes, which appear intravascularly in connective tissue adjacent to the bottom of the sulcus. From there, they travel across the epithelium to the gingival sulcus where they are expelled. They are viable and phagocytic. They constitute a major protective mechanism against the extension of plaque into the gingival sulcus. These are the two broadly defined leukocytes. It can be granulocytes or agranulocytes. Granulocytes includes neutrophil, eosinophil, and basophil. Agranulocytes includes your monocytes and lymphocytes. Now we'll see a short clipping about how this leukocyte function as a defense mechanism.
The white blood cells are an important part of our body's immune system. Neutrophils are a special group of white blood cells that play an extremely important role in protecting the body against infections. Mature neutrophils do not divide. New neutrophils are constantly formed in the bone marrow where they develop and mature. Mature neutrophils are released into the blood where they circulate for 3 to 12 hours and then move to other tissues where they survive only 2 to 3 days. These mature neutrophils can be found in large and small blood vessels, as well as in the tiny capillaries in different tissues. In the bloodstream, neutrophils act as surveillance cells searching for infections. Neutrophils can sense a site of infection because of chemicals that are released by the bacteria. Upon detecting these chemicals, neutrophils slow down and begin to stick to the walls of the blood vessel. They then squeeze between the cells of the blood vessel wall and enter the infected tissue. Here, the neutrophils crawl towards the infection as they continue following the chemical signals. At the site of infection, bacteria are coated with antibodies of the immune system and marked for ingestion. The neutrophil recognizes the marked bacterium, engulfs it into its body, and traps the bacterium in a sac called a phagosome. The neutrophil contains pouches called lysosomes, which are full of digestive enzymes and chemicals that can kill bacteria. The pouches, or lysosomes, then combine with the phagosomes containing the bacteria and release the enzymes and chemicals, resulting in the ultimate death of the bacterium inside the neutrophil. After killing and digesting the bacteria, the neutrophil is spent. Having completed its duty, the neutrophil shrinks in size and breaks up into smaller pieces that can be recognized and eaten by other cells.
So I hope now you got a brief idea about how GCF, saliva, and neutrophils play a vital role in the defense mechanism of gingiva.